broadcasting around the world 24 hours a day. This is Carers World Radio with Patricia Mitchell.
Hello and welcome to Carers World Radio. On today's programme, we take a look at the new Carers Direct website and what it has to offer the 6 million plus carers across the United Kingdom. And from 2010, there'll be a new government-supported savings scheme which will help people save by making a government contribution of 50 pence for every pound saved. Now, this will have a direct positive impact on carers, and we'll be speaking to Matt Hill from Carers UK about the likely effect of the scheme on carers. All this plus much more on this month's Carers World Radio. In August 2007, the government announced a programme to develop the first national dementia strategy and implementation plan for England. Now, following a huge public consultation process, the strategy has now been developed and has recently been published. The aim of the strategy is to ensure that significant improvements are made to dementia services across 3 key areas: improved awareness, earlier diagnosis and intervention, and a higher quality of care. The strategy identifies 17 key objectives which, when implemented, largely at a local level, should result in significant improvements in the quality of services provided to people with dementia and should promote a greater understanding of the causes and consequences of dementia. To tell us more about the strategy, I'm extremely pleased to welcome to the programme Phil Hope, Minister of State for Care Services and MP for Corby and East Northamptonshire. Minister, thank you so much for joining us today.
Hello, it's a pleasure being here.
It's great to have you on board with us on this because this is a huge consultation. It's exceedingly extensive. It's also, I have to say, having read not all of it, but a large chunk of it, incredibly ambitious. It's got a 5-year time frame for the moment. What do you see as being like the key motivators for getting this up and running?
Well, we've been extremely concerned about care services for people with dementia and their carers as well. And throughout the consultation process, we were keen to hear the views of sufferers and those families and friends that are looking after people with dementia to make sure we got it absolutely right. And I'm delighted to say this is the first ever national dementia strategy, and it does have a number of key components. And the first one really is we really want to ensure people get much earlier diagnosis. We've got some 700,000 people with dementia in the UK, but only a third of those are formally diagnosed. And that means if you're not properly diagnosed, we can't intervene early to ensure that the dementia sufferer and indeed their carers get the best support that's available so they can really live well with their dementia by getting in early to help them through those problems. So a major plank of the strategy is to get this early diagnosis done so we can do earlier intervention and to train GPs to spot the signs of dementia early so that they can refer people onto these new memory clinics, dementia specialists who can really make sure that the person is properly diagnosed and gets the proper support and care they need.
I know that this strategy is not supposed to be a clinical guideline. It's not telling the clinicians what to do. But in having said that, I would have thought with dementia's obviously got that horrible connotation around it. There are a lot of people that may not want to know that they've got dementia. They may just want to be blissfully ignorant. What are the benefits, both for the state, if you like, and for the sufferers of dementia and their carers to have this early diagnosis and for the system to support them in it?
Well, firstly, you're right to say that there is a huge stigma attached to dementia. People are almost frightened to go along to the doctor to be diagnosed with it because they're worried about what happens then. And in a way, dementia is where cancer was 20 years ago. I mean, today we talk about it. People are much more open about it. It means that earlier diagnosis of cancer can help people either be cured or to get better treatment. We need dementia to sort of come out of the shadows in the way that cancer has, to have a much more open debate about it. Because if people do go to their GP and the GP does spot the signs, and there's some professional training work we want to do with GPs there, then they can be referred to a specialist. Now, the specialist can then diagnose what kind of dementia, well, confirm it is dementia in the first place, then what kind of dementia it is, And then they can take earlier intervention. They can work with patients and their carers to ensure that they can live well. And actually, even the breaking of the news can be so much better done. I met a man in my constituency where the GP kind of said, well, I'm sorry to tell you, you've got dementia, you'll never work again. And this is early onset dementia for a 53-year-old. I mean, it simply isn't true, for one thing, and secondly, it was like a death sentence. Now, people can live with dementia, very fulfilled lives for many years, but if we can get people to understand that, get diagnosed earlier, and then very practical help and support for individuals, how they can stay in their own homes, stay at work, be supported while they've got the early signs of dementia. And then as the disease progresses, actually we can hold back the progression of the disease by doing very simple memory exercises, people learning tricks. Let me give you an example. If one of the problems is in dementia you lose your memory of the short-term things, like where do you put your keys, you can be trained up to always put your keys when you come in the same place. Unlock the door, put the keys in the same place every time. A very simple strategy, and you can multiply that 1,000 times in terms of tricks and things that people can do to help them live well, live good, fulfilling lives whilst they've got the dementia.
Well, Minister, thank you so much for explaining in so much more detail and with such clarity the strategy, its purpose, how it's going to be rolled out. We look forward to catching up with you at some time in the future, and thanks very much for your time today.
Well, thank you very much. And I just want to say I know how much carers matter to people, not just with dementia, but indeed with many other conditions. I'm so full of admiration for the work that carers do. So please convey my thanks to everyone who's taking on sometimes a very demanding role, and thank them for the contribution they're making.
NHS Choices is a comprehensive information service that helps to put you in control of your healthcare. Now, the service is intended to help you make choices about your health, from lifestyle decisions about things like smoking, drinking and exercise, through to the practical aspects of finding and using NHS services in England when you need them. As part of NHS Choices, there's a part of the website which is dedicated directly to carers. Now, Carers Direct highlights national information as well as local information for carers. Now, to tell us more about the Carers Direct website, we have Shane Hayward-Giles, a Programme Director at the Department of Health. Shane, thank you so much for joining us today. Let's talk about Carers Direct. I know that it's quite a comprehensive service, but for those who have maybe heard of it, haven't used it, for those that haven't even heard of it, tell us a little bit about what Carers Direct aims to do.
Okay, Patricia. Very essentially, what we're trying to achieve with Carers Direct is provide a comprehensive information service that's accessible 7 days a week to all carers in England, and that includes young carers as well. The thinking that's led to Carers Direct was born out of a commitment that we made in the white paper, Our Health, Our Care, Our Say, and was later confirmed within the Carers Strategy published last year. And those commitments recognise that despite the very good work that's going on around England already in terms of supporting carers with information, that there's actually no one single comprehensive service. And that might be because the services we've got at the moment only cover a particular geographical locality. They might not have a great deal of financial and therefore staff resource. Or they may simply be very good, but relate only to carers, say, of those people who are caring for someone with Alzheimer's. And the ambition for Carers Direct is to try to make sure that we have a comprehensive service wherever you live in England. What I have to say there is we don't see it as the be-all and end-all. We see it as part of a continuum with all the other services that exist at the moment.